Is it okay to drink alcohol while on hospice? Well, it depends. It depends on a person's lifelong relationship with alcohol, and more importantly, it depends on whether it brings comfort. Some people are genuinely relieved when I tell them and their families, yes, it's okay and safe to enjoy happy hour, especially if it's been part of your daily ritual. Others are going to drink regardless, simply because it's what they've always done. In my experience, as patients decline, particularly those with a significant disease process like cancer, they often lose the taste for alcohol. But not always. And for many, it's not really about the alcohol, it's about the ritual. Recently, I had a family who was surprised and absolutely delighted when I encouraged them to continue enjoying happy hour together. Granted, my patient barely sipped his cocktail, but that moment together felt good and normal. His lovely wife was especially happy to have her 5 p.m. gin and tonic without guilt. Of course, this can go off balance. Once I cared for a woman who, in the last 3 weeks of her life, started to drink only high-end scotch. We even were stirring the Miralax into it. But this became a concern because she grew aggressive and unkind to the family members that were taking care of her, and they didn't feel comfortable just saying no to her. Years ago, I learned something simple and powerful. When a patient was actively dying and we were just struggling to manage symptoms and get things under control, I'd ask the family to bring out the loved one's favorite drink. And with a small syringe, I placed just a few drops on their lips and their tongue, and they would just let out a soft sigh of contentment, and it was obvious it worked. The taste and smell alone was comforting. And I'll never forget this delightful woman who used to take her little oral sponge and dip it in her wine. This was her way of staying connected to something that she really enjoyed. To be clear, this conversation isn't about alcoholism, which requires special care and attention during the dying process. This is about recognizing that it's okay to use alcohol and the ritual around it as a comfort measure at the end of life. Click the link below and get a copy of our booklet, The Hospice Care Plan. This booklet's helping families and caregivers safely and effectively care for the hospice patient at home.